Anyone have any questions?
I have a question.
Yes, ma'am.
My name is Teresa Hendricks. I'm from Office Sponsored Research. Thank you all for allowing me to attend. I find it very interesting. One question for you. What I've heard is that the clinicians are not basically implementing this because it's also new to them.
Yes.
Does TCU, more specifically, I guess your department or your program, do you all bring in preceptors, from the experiential portion to allow them to get exposed to EVP?
Those that we know are utilizing EBP in one specific area, we will try to do that as much as possible. For example, we have a clinician on campus who needs to stay very up to date on concussion information. As much as possible, we try to get that information from him, and he disseminates it to the students that are specifically assigned to him. As far as having other people from on campus come in, our students see them on a daily basis anyway, so we try to focus on others in the community.
Right, that's what I'm talking about, in the
absolutely.
community.
Yep.
Not sure, if you have preceptors that are outside of the community, because I know oftentimes professional schools have you have those preceptors out there that oftentimes they may look to the institution for additional training, where they can get some additional CEUs to keep them in the know.
Yes. Yes.
So I was wondering if that's what we do for those.
Yeah, we do it right now, I'd say,
Preceptors.
on a very informal basis. So we definitely have clinicians that will come in and disseminate their information. We've had 2 sessions since I've been here. This is also only my 2nd year. We've had 2 sessions where we've had other clinicians come in and offer CEUs to both our on-campus and off-campus clinicians. So just as an example, we had a woman who works with the Rockettes and the touring chauffeur in the floor. So she has a lot of dance medicine expertise. So we had her bring her expertise to us and offer it in that sense. I did have a large idea last year that I was not able to move forward with, as far as having kind of an EVP from an athletic training standpoint here on this campus. I would love to have that. Last year I was a little overwhelmed with trying to get all these publications out and things, so that's still a vision that I have. I just haven't been able to actualize it yet.
Okay, that was my ultimate question regarding
Took me a while to get there, but
That's okay.
we
We did do a similar workshop with our preceptors that we use as an annual training, and that was part of what was included in that. It was more of a programmatic overview of things, but that was Sarah did do a little bit of an EPP kind of module with them quickly, so.
Oh, okay.
I have a multi-part opinion and question.
okay.
I think that the solution is for your national organization to require EVP as part of accreditation for any program. And then you have to deliver it within the program, and it would force programs to somehow incorporate EVP into existing courses or create other courses. And then second question is, even so you're using EVP, but athletic training is a younger profession, is that right? And so I wonder if there is a lot of evidence available to generate a lot of statements or outcome positions on a lot of the treatments that you might do, or maybe it's in other literature, like maybe it's more in physical therapy or something. And then thirdly, are there other countries that are farther ahead in, incorporating EVP into training and practice that you might learn from? An example, we had a class go to Australia last year, and within speech-language pathology, they're a little bit more further advanced in teaching it and then, using it in the clinical world. So I'm wondering what's happened outside of the U.S.
Yeah, those are all great points. To address kind of our young profession and the existence of literature, we're definitely lacking. We don't have anywhere near a high number of scholars that are producing things, and so we do have to look to those other professions. Now, one of the unfortunate things with athletic training sometimes, and this isn't across the board, it's just usually intermixed, but you'll get someone that says, well, I'm not looking at the physical therapy information because it's not athletic training. So they have that, there's such a rift between those two professions of going, well, I'm not even going to look at it because it's from that perspective. They can't see the globalization of the information within that document. So we have a little bit of a struggle in that realm. But yes, the information is there. And again, we have to get it to them. We have to familiarize our clinicians with the Cochrane database, with all of the other areas that you can find it. Just because it's not in the Journal of Athletic Training doesn't mean it's not worthwhile information. So we do need to expand it, number one, but also number two, look to other people for what they've done. The second component, as far as other areas that are ahead of us, Australia for sure. The physios, that's basically one of the adaptations of names for our practice in Australia. They are far ahead of us practice-wise in demonstrating the effectiveness of their procedures. So that's certainly a place that we can look to. And next week when I go there, I'm hoping to have conversations about that to see what they're doing and how they're doing it and bring that information back here. Also, certain elements of, or certain portions of Europe are far ahead of us as well. Even regionally in the US, it's kind of, who at least has the information. It might not be officially documented and published yet, but the Northeast and the East Coast are a little farther ahead than Midwest, West areas. So, yes, ma'am.
Just to put in a plug, again, you put one in at the beginning for the college's Center for Evidence-Based Practice and Research. I think there's great opportunity for synergy among the disciplines in our college, as well as in other colleges on campus. But those nursing is a little bit further ahead than athletic training. But oftentimes, I think if those faculty could pair together or those students could pair together and really look at some of the common problems, because the whole healthcare system is moving away from hospitalization. So, and I know a lot of times athletic injuries cause hospitalization. So some way to begin looking at those clinical questions cross-disciplinarily, could help in terms of information available, evidence-based practice for athletic therapy as well as in other areas. And my understanding is that the whole science of how you get people to change, when you realize that you need to adopt a new type of way of doing things, that there's lots of, through the Joanna Briggs Institute, there's a whole cadre of tools to help us figure out how to do that. So I think we're really an ideal spot here to really create some new things.
Yeah. No, I agree. This is just a complete kind of side story. When I came here for my interview, I was sitting in, the lobby area of Dean Burns' office, and they had a Joanna Briggs evidence-based sign sitting there and how they were a collaborating center. And I can't tell you how many times I cited that institute in my dissertation, so it really was kind of like I'm in the right place whenever I was sitting there. So there's definitely opportunity for us to collaborate and create sort of a nice interdisciplinary approach between us. Dan, did you have a question?
Who does the research that you actually look to for your evidence in your evidence-based practice? If you're clinicians out there, who actually does that research?
Currently, there's usually going to be a director of a research center. Some of those are at, some of our larger Tier 1 institutions, such as Duke, Ohio State. So it's going to be people that practice. Most of them right now practice for anywhere between 5 and 10 years, and then have pretty much gone the strict scholarly route at this point. So they're not practicing anymore. But yeah, each area kind of is very specific to a body region, if you will. So University of North Carolina, for example, they're very much into the knee and concussion research. So if you want that, you go there. University of Connecticut, if you're looking at hydration, that's where you need to go for that. So it's all kind of very targeted and region specific.
So these are exercise physiologists, biomechanicians?
Athletic trainers by initial profession, and then many of them have the additional studies in either biomechanics or exphys. We have a couple in psychology, but yeah, overall it's going to be kind of that combined.
And is there a journal that they can submit their work?
Overall, we look primarily to the Journal of Athletic Training to get to our professions, but that actually, its overall rating is a lot lower than something like the ACSM journals or the American Medical Association, any of those, JOSPT, so physical therapy. So since our ratings are lower, sometimes they'll try to submit to those other journals first, and so it'll just take a little longer to disseminate it, because if then they get turned down from there, that's usually when they'll go to JAT.
Since these different research center areas, you're talking about they get specific to certain types of research, which one are you going to tackle?
Which one am I going to tackle? I'm definitely more on that.
We're going to be the research center for something.
Yeah, we're gonna be the research center for educational preparation. and for clinical education, and really trying to bring those two things together, clinical
And
education.
pull any of the main research going on at these other centers into the collaboration.
Yeah, I'm not trying to turn us into a specific shoulder joint center or anything like that. That's, I have interest in those things.
Stay more education.
Yes. Yes.